Hi, I'm Dr. Brian Nelson. I'm a board-certified obstetrician gynecologist here at the Longmont Clinic, and I want to talk to you about an often embarrassing problem called urinary incontinence. At least 25 million American women suffer from this problem every year, and unfortunately they think they have to live with it, that it's a normal part of aging. But there are many relatively easy treatment options for these women. There are two main causes of urinary incontinence in women. The first is what's called stress urinary incontinence. This is when a woman leaks urine when she's coughing, laughing, sneezing, or even exercising. Although childbirth is probably the greatest risk factor for stress incontinence, other factors can be genetics, smoking, being overweight, or a very vigorous lifestyle. So the normal anatomy, we have the bladder and the urethra. At the junction is essentially a ring of muscles which maintains the urine within the bladder. Unfortunately, activities such as childbirth can tear some of those attachments so that those ring of muscles do not work adequately. The most common treatment option for women for stress incontinence is something called a sling procedure. This is a procedure where the physician makes a 1 centimeter incision in the vagina and places a small ribbon-like piece of material underneath the urethra. It acts like a backstop, so when a woman is coughing, laughing, or exercising, the urethra is compressed closed so she doesn't lose any urine. This takes about 15 to 20 minutes to perform. A woman goes home within an hour, and immediately she should have significantly improved control of her bladder. The second most common cause of involuntary urine loss is something called overactive bladder. This is when a woman feels a sudden sense of urgency and must rush to the restroom where she feels she's going to leak. There are some behavioral changes a woman can make, but often they will require medication to try to keep the bladder relaxed. This will allow her to wait until it's convenient to go to the restroom. So if you're one of the 25 million American women who suffer from involuntary loss of urine, please contact your doctor. There are many relatively easy treatments for this to let you get back to the life you deserve.